Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome to our podcast series on Nurse Scientist. This is Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast where we share the most up-to-date education for healthcare professionals. Now, did you know that nurse-led research has actually contributed to breakthroughs in areas like infection control, chronic disease management, and even patient safety? And despite these critical contributions, the role of a nurse scientist is often under-recognized. Did you even know we had nurse scientists? Now, nurse scientists play a pivotal role in advancing healthcare through research, through innovation, and even evidence-based practice because they are both clinicians and researchers. They're able to bridge the gap between bedside care and scientific discovery, which of course is going to drive improvements in patient outcomes and our overall healthcare systems. So in this episode, we are going to be discussing the multifaceted role of nurse scientists and their impact on healthcare and how they collaborate with interdisciplinary teams to address complex challenges. The goal is really to provide you with a deeper understanding of the value of nurse scientists and what they bring to our field, and really inspire more engagement with nursing research. And also, did you know this is another career option in our diverse healthcare field? Now, joining me for this discussion is Margot Helm. Margot, thank you so much for joining me today.
Thank you so much for having me. I'm really excited about this opportunity.
I'm excited to learn from you because I love research and I love being a nurse. So can you tell us a little bit about your background?
Yeah, so I actually have been a nurse for over 40 years, and the last 20 years I have been practicing as a nurse scientist and a director of nursing research and quality and a number of other hats that I'll get into a little bit later. So I have practiced as a director of nursing research and quality at three different large magnet facilities in the Midwest and also on the West Coast. I'm located in Oregon now and have really loved this role. I was a clinical nurse specialist prior to
Mhm.
being a nurse scientist, and
Yeah.
this pathway allowed me to really bridge my passion for clinical practice and working with frontline nurses and
hmm
bringing in evidence-based practice and research. So it's really an amazing, impactful role that I'm so excited to talk to you about today.
Yes, and I'm so excited to learn about this and how we can bridge this gap. I am going to be honest, I think I am getting over a cold. So if my voice goes in and out or if you hear me coughing, and I think, Margot, you mentioned some allergies. So we might have some sneezing and some coughing going on, but we're going to get through this. And I'm really excited to learn from you. So you have a super busy schedule, and so I'm really grateful that you gave up some time to come and teach us about being a nurse scientist. And you might be one of the first nurse scientists that I have officially met with the official title of nurse scientist. So what is a nurse scientist, and how does this role differ from other nursing roles?
Yeah, so great question. So, a nurse scientist is a nurse, and typically they hold a PhD or sometimes a DNP, and they specialize in nursing research. So, the role focuses primarily on scientific inquiry. We conduct studies to expand nursing knowledge and improve patient outcomes. We publish those findings and bridge the gap between research and clinical practice. We've learned recently, we've heard 17 years is the research to practice gap. And we've learned in recent years from Dr. Melnick's work that we've narrowed it a little bit. It's 15 years. So it's still not acceptable, but we are making some progress. So that is our role, is to bring that evidence to the front line to have it embedded into practice in a much uh, faster,
Faster.
faster process.
Yes.
We also mentor other nurses and nursing students in clinical inquiry. So We really focus on scientific inquiry. Now, to differentiate the nurse scientist from other roles, nurses who are engaged in patient care, professional development, or administrative tasks, such as nurse leaders, our efforts are totally dedicated to scientific discovery and applying that new knowledge to enhance health outcomes. I'd like to mention that there are many different models for a nurse scientist.
Hmm.
There's what I call the pure nurse scientists. So these nurse scientists are employed to develop their own program of research. And I
Hmm.
witnessed this when I was the director of nursing research and evidence based practice at the Portland VA healthcare system here in Portland, Oregon. Many nurse scientists in the VA system have their own program of research to improve specific outcomes of veterans. The
Really?
Yeah, the Mayo Clinic is another institution that has this model. Other nurse scientists may have a joint appointment and have a collaborative role with the School of Nursing. So they share part of their time with the school and part of their time with the healthcare institution. Other other nurses are employed in dual roles. So I mentioned earlier that I've worn many different hats. So not in addition to research, also having oversight for education or quality or even the magnet program.
Hmm.
And some nurse scientists today are interested in the clinician nurse scientist role. So they have maintaining an active clinical role so their research can really be informed by real world clinical experience. And then lastly, the clinically based nurse scientist role is emerging as an organizational driven role where the nurse scientist is engaged perhaps in their own program of research, but a large part of what they're doing is work related to organizational priorities. So, strategic aligning EBP and research with some of the main strategic directions and organizational priorities.
Hmm.
And a recent AACN survey, Colleges of Nursing, in 2022 found about 9% of PhD graduates go on to serve in a clinically based nurse scientist role. And I was one of those individuals that chose that path 20 years ago.
Wow. So I know you were talking about disseminating research, and it seems like there's going to be a differentiation between those who say are teaching in an academic setting, and they want to make tenure, so they try to publish or do some smaller research studies, maybe a smaller scale. But this is a bit different here, that what you're talking about, correct? As far as a nurse scientist versus those in that academic setting who are they're also adding to the body of knowledge, but the focus seems different. Am I interpreting that correctly?
Yeah, yes, you are for sure. I mean, both academic faculty members are nurse scientists,
Hmm.
and clinically based nurse scientists are also contributing to generalizable knowledge, but the focus may be different.
Okay, I just wanted to make sure. One of the qualifications that you talked about when you first started was the PhD, or maybe even a DNP. But are there other qualifications, or even just like a skill set or skill sets that we really should have if we're interested in becoming a nurse scientist?
Yeah. So, of course, first becoming a nurse scientist involves becoming a registered nurse and developing some specialization in a
Hmm.
clinical role,
Hmm.
ambulatory care, critical
Hmm.
care, oncology, rehabilitation nursing, etc. And that clinical experience really provides the foundation for the nursing and health related inquiries that a nurse scientist will be equipped to answer. Many nurse scientists, their educational pathway starts with a master's degree in nursing, not
Hmm.
always, but often. And then it terminates with the terminal degree, a PhD in nursing, which that program is really focused on developing nurse scientists that are able to perform their own independent program of research versus a DNP.
Hmm.
Those also can be employed in nurse scientist positions, but that degree program is focused more on translation of research of
Hmm.
evidence into practice. So they're more the implementation science experts. And along with that educational background, obtaining experience in clinical research also helps to hone research design and analytical skills. So some of the key skills of a nurse scientist are able to design research, to be able to plan and conduct studies addressing health related issues, using theory, also models and frameworks to guide the research. Strong analytical skills, including statistical know-how, as well as qualitative methodology.
Hmm.
Ethical knowledge is really important. We need to understand ethical guidelines and federal regulations to ensure that we are protecting human subjects as we are executing our research protocols. Communication skills are huge, both oral skills, so we are able to talk with our patients and families who are research subjects, as well as being able to communicate those research findings to the public and to professionals through podium presentations, poster presentations, etc. Written communication skills, I would say, need to be really solid. We need to be able to communicate our ideas in grant proposals so we can secure the funding that we need, right, to
Right.
investigate these important practice problems. And then also to be able to disseminate and to contribute to the generalizable body of knowledge and scholarly literature.
Hmm.
We'll talk about collaboration in a follow-up question
Yeah.
in a while, but collaboration is really a key skill. We are working with patients, nurses, other members of the interdisciplinary team, as well
Hmm.
as the public, depending on what our areas of research interest might be.
Right. So you need to be able to talk to people. That's what you're saying. This
Yes.
is not a solo job. It's not a you actually have to interact with people. So those are really good, some really good key skills. Now, you mentioned a couple of places that you have personally worked, but where do we see a lot of nurse scientist practice, or where do we not see a lot of nurse scientist practice, but are options? And what kind of organizations employ nurse scientists?
Mhm. Well, nurse scientists work in a variety of different settings, hospitals and health systems, as I mentioned. They
Hmm.
may be employed by research institutions and universities, right? So think about our nursing faculty members. Other
Right.
areas might be government agencies or industry partners, private
Hmm.
companies.
Hmm.
Press Ganey has a nurse scientist, for
Really?
instance,
Oh.
and nonprofit organizations that are focused on healthcare, such as professional nursing organizations. So I actually wear two different hats right now. I'm a nurse scientist at Salem Health in Salem,
Hmm.
Oregon, where I was previously the director of nursing research, evidence based practice, magnet, clinical education. I wore many different hats.
Yes, you
Um,
did.
so now I am employed as a per diem nurse scientist. And then 2.5 years ago, I accepted a position as a nurse scientist for AAACN, which is the American Academy of Ambulatory Care Nurses. So that's an example of a professional nursing organization employing a nurse scientist to help them move their strategic priorities and directions forward.
Can you talk a little bit about how nurse scientists can help those types of organizations move their strategic planning forward?
Yeah. So the main strategic direction that AAACN really envisioned this role was to help to advance the body of knowledge.
Hmm.
Ambulatory care nursing is one of the fastest growing specialties because care has really shifted into the outpatient setting, and recognizing that and then looking at the body of knowledge, it really there was a gap between the knowledge that ambulatory care nursing needs and what
Hmm.
what science we have to build from, right? So that was the
Right.
impetus for creating this program, or this position, excuse me. And so the nurse scientist position at AAACN chairs a national research committee with other nurse scientists across the country to help to
Hmm.
move that strategic direction forward. We recently completed a national survey study of ambulatory care nurses to engage with their perspectives on what are some of the key national priorities of research that needs to be conducted to help us move our specialty forward. So that's like one research side of the strategic direction, but then
Hmm.
also we're helping the organization build the capability of ambulatory care nurses with evidence-based practice. And we do that through presentations at our national conference, workshops, webinars. We have a toolkit on our website. We also have a consultation service where we will meet with an ambulatory care nurse that needs a little direction to move their EVP, QI, or research idea forward. So,
Okay.
yeah, it's a really unique. It's a similar role to working in a hospital and healthcare system, but with a
Hmm.
different population.
Hmm. How is this particular role different from, say, a nurse educator? Just listening to kind of some of the things that y'all are doing on your team. How is it different than a nurse educator?
Well, I failed to mention under the key skills for nurse scientists that and mentoring is another one of our key skills, skill
Sets.
sets. Yeah,
Yes.
skill sets. So I think it's really what would I say? Complementary to a nurse educator. I mean, we're using education and mentoring skills in our role as a nurse scientist. So I
Uh-huh.
think it's complementary to a nurse educator who is also involved in their organizations in helping nurses build their skills in research and EBP.
Mhm. So, in your group that you're working with, are you also, as a nurse scientist, helping to develop or figure out best practices within that setting? So, within ambulatory care, for example, looking and doing research on best practices to develop evidence-based guidelines, per se.
Yeah, so that's an interesting goal that we have on our horizon. We've only been in existence for a couple of years, and we've just compiled the results of that national research study on our ambulatory care nursing priorities. So we do have plans to be looking at EBP best practices in ambulatory care and have submitted an abstract for next year's conference. Knock on wood, it gets accepted,
Right.
and
Yes.
it's actually focused on de-implementation. So as much as nurses need to look to the evidence and adopt new innovations because
Hmm.
they've shown to lead to better outcomes, we also need to let go. We need to let go of
Yeah.
things that are no longer effective and potentially
Hmm.
harmful. So we hope
Hmm.
we have the opportunity to talk about de-implementation and help ambulatory care nurses let go of things that no longer make sense.
I think all nurses, we have to let go of things that no longer make sense. Or, honestly, things that, yes, that's the way we've always done it. But new research shows us from nurse scientists and other people who are doing research that this is no longer what we thought it was and is actually doing more harm than good, or it's just not beneficial at all. So I
Definitely.
love that. I love that you're
Yeah.
putting a title on it too, de-implementation. It reminds me of de-prescribing. So de-implementation.
hmm
Um, Now, looking backwards at this role of nurse scientist, when you go into nursing, or maybe when I went into nursing, I didn't realize just how diverse our field actually was within healthcare and all of the different roles that are out there for nurses to be able to be a part of. And one of them that I didn't know existed was nurse scientists. So, what is the historical evolution of this role as a nurse scientist, and how has it been shaped as, healthcare continues to change and evolve?
Great question. So, nursing science really has undergone tremendous transformation from its roots with early pioneers. It really dates back to Florence Nightingale. She laid the
Hmm.
foundation for evidence based practice back in the Crimean War in the 1850s.
Yes,
And
and when I think of innovation, like an innovator, I go all the way back to her as well because she really was an innovator and a researcher.
she was. Yeah, she's revered by statisticians worldwide.
Yeah.
So, Florence Nightingale is really our roots as nurse scientists. And then in the early to mid 20th century, nursing research really started to focus on nursing education, administration, and workforce issues. And then as the 20th century advanced, we started to see a shift towards patient care and clinical practice
Hmm.
science starting to emerge along with some of the foundational theories like Peplow and Martha Rogers, and these theories provided the foundation for clinical practice and research. Then in the 1970s and 80s, universities started to expand their nursing schools. And so that's when the rise of nurse scientists with nursing faculty really started to increase. And their work centered on independent research, theory development, and patient outcomes. Then in the 80s, research interest broadened to patient behavior and responses to illness. We also saw an emergence of qualitative methods and interdisciplinary collaboration. And a major milestone that happened in the 90s uh, was the creation of the National Institute of Nursing Research (NINR) with
Mhm.
the NIH,
Yeah.
and this has really sustained our federal support for nursing science. And we're celebrating 40 years of the NINR this year. So that's super
Wow.
exciting.
That is.
And then I would say one of the major forces that have led to the emergence of this clinically based nurse scientist is the magnet recognition program. And that program started in 1994, and it spurred the beginnings of nurse-led research in healthcare organizations. So this prompted healthcare organizations to employ or to partner with other nurse scientists. And then as we fast forward today, of course, the magnet program is still going
Mhm.
strong. And the Future of Nursing report of 2023 called for an expanded nurse scientist presence in clinical settings. And so this term clinically based nurse scientist is starting to emerge. And there are nurse scientists leading that effort across the country and really wanting to bring a subspecialty to nursing for the nurse
Mhm.
scientist role, which is really super exciting to me to see this evolution over the last 20 years that I've been engaged in this work.
Mhm. It seems like too, I wanted to ask about bias. Is this something that we've had to overcome historically as far as what nurses can bring to the research table?
Yeah, I think there is, some perceptions that, nursing research or research in general is an academic exercise, that it doesn't
Mhm.
have a place in a healthcare setting. So I think there is a lot of work still to be done in terms of various leaders, perspectives, other
Mhm.
individuals
Mhm.
in organizations. When I was practicing at United Hospital in St. Paul, Minnesota, years ago, working with staff nurses on a research committee, we wanted to bring an evidence based practice into the perioperative area. And a physician basically said to us, we're not a research institution and we need to stop trying to act like we are one. So that's
Mm,
an example of a barrier that frontline nurses and nurse scientists, depending on where you practice, still
right.
likely encounter, unfortunately. So we need to
Absolutely.
really educate people that research fuels what we do at the bedside.
Right. And I do still see some bias and, well, you're a nurse. Yeah. Yes, you're a nurse, but you have a PhD, or you're a nurse, but you have a DNP. You've been trained in research. You've been trained in statistical analysis. You've been trained in how to disseminate evidence and even be a part of developing research studies, developing your own research studies. So I do still see some of that bias in, well, you're just a nurse, but you have so much more to bring to the table.
Don't get me started on the phrase, "I'm just a nurse."
I'm like, yes, I am just a nurse, but I have so much more to bring to the table. Um, yes. So, but it's not good that we still see that, but just being aware and knowing that, unfortunately, there is still, and I don't even know if I would call that bias. Sometimes I just call that being mean.
I think it's
Um,
also just being uninformed.
yeah, uneducated and uninformed of what our roles actually are and how we can work together for the good of our patients really is what that is. You're right. Now, what are some examples of groundbreaking research that has been led by nurse scientists? And Um, how has that impacted our healthcare or contributed to policy development? And I know you're going to go right back to Florence Nightingale. I'm waiting for you to start with her because we know she has some groundbreaking research that that got us to where we are today.
Yeah, she is super exciting to talk about. Actually, I was going to talk about three other nurse scientists, but you're right. Florence Nightingale um, really uh, did
Hmm.
a lot of things for soldiers and shored up infection control practices and used
Yeah.
essential oils and all sorts of different practices to reduce mortality and to improve care of soldiers. Some other nurse scientists that I'm really excited to talk about. My dear friend and colleague, Dr. Kathy Guzetta.
Hmm.
She is a pioneer in a practice that is near and dear to my heart, family presence during resuscitation and invasive procedures.
Hmm.
And this practice has been around actually for 40 years. So in the 1980s and 1990s, she led cutting edge research on family presence, providing the first evidence that allowing families to be present at the bedside of a family member who is undergoing resuscitation actually benefits both the patient and the family member, and it does not hinder care. And this pivotal research really helped shift the discourse. And now policies worldwide, um, are have been
Hmm.
developed along these lines, and it has now been widely supported. Although we did have a setback during the COVID-19 pandemic with
Right.
all of the
Yes.
family restrictions, but she and I and other colleagues recently updated the practice alerts for the American Association of Critical Care Nurses on family presence during resuscitation and presented that at the National Teaching Institute. So
Hmm.
she is definitely forerunning nurse scientist in my mind. Another nurse scientist I wanted to mention is Dr. Linda Aiken from the University of Pennsylvania. She is internationally recognized for her rigorous research linking nursing education, nursing workload, and work environments to patient outcomes, specifically mortality and failure to rescue.
Hmm.
And her work has directly informed healthcare policy, leading to nurse staffing laws and evidence based staffing guidelines in the US and abroad. So that's just amazing program of research that has
It
really made
is.
a difference in the lives of nurses and patients.
Hmm.
And then the third nurse scientist I wanted to talk about, I learned when I was inducted to the American Academy of Nursing 2 years ago, Dr. Roxana Chicas from Emory University was also inducted. And I was just really blown away as she presented I think, in a panel presentation. She is leading field based science with outdoor workers, and they are wearing BioPatch technology that monitors their physiological measures, including their skin temperature, their heart rate, and their respiratory rate. And she is
Wow.
using these data to train AI. And so eventually her goal is for AI to be able to predict an outdoor worker's risk of a heat related illness. And so her research really has the potential to shape workplace safety standards and labor regulations. So this is a really fun question. It's always wonderful to highlight the tremendous impact that nurse scientists are having on health.
Absolutely. And these are really big ones that you're talking about, but um you can also there's also smaller ones, so I don't want anybody to feel like, "Oh, I have to do something big like that." Absolutely not.
Yeah, you're absolutely,
Um
absolutely right.
yes, I actually have there's a podcast that we recorded on evidence-based practice around intravenous IVs and giving intravenous fluids and medications. And she actually did a lot of research, and a lot of the things she talked about, I didn't even realize we should not have been doing, or.
Right.
So, and she has a panel that she's working with to try to get changes made to how we teach and how we put in IVs and how we use them and put medication in them. And so it's smaller scale, but she's out there talking, she's out there showing the research, she's doing the research. And it doesn't have to be huge to make a difference.
And all of these nurse scientists I mentioned, they started small too, and their programs of research built. So I think it's planting the seed with the research
Yes.
questions and building on that over time. So you're
Hmm.
exactly right. One study in a hospital can have tremendous impact on patient care, and then it could be scaled and spread to other areas to make a bigger impact.
Absolutely. And you don't have to have nurse scientists after your name in order to participate in these or start these, or even if you just have an idea, like you're talking about planting a seed, and then somebody else who is someone who is we all have different personalities. So someone who can challenge it and push it forward, that's okay too. So it's just getting out there and seeing a problem and how can we fix that problem, I think are so important. And really that leads us into my next question I have for you, which is, how do we align the goals of healthcare organizations to help with improving quality and reducing costs? And I think that's going to start with these smaller scale research that I was just kind of hitting on. So what are your thoughts on that?
Yeah, so I think it's really critical that nurse scientists really anchor their work on mission relevant research, EBP, or QI
Hmm.
initiatives, focusing on what some of those high impact priorities are, various different quality metrics, nurse sensitive indicators, value based care goals, patient experience, and nurse engagement and retention. So, if we can find out what those priorities are, then we can apply the best available evidence and practice innovations that can improve um, the quality of care and also reduce cost. So it's really important that nurse scientists are able to show the return on investment of their studies or their evidence based practice initiatives. And we can do that through things such as cost avoidance. If we have an evidence based practice initiative on practice, a new uh, pressure injury prevention protocol. We can show how
Hmm.
many
Hmm.
hospital acquired pressure injuries that we have avoided, and we can look to the literature to see what an average hospital acquired pressure injury costs, and then we can
Hmm.
annualize that and to be able to show the impact of our role on organizational priorities and cost containment. And also, many of these initiatives can avoid value based purchasing penalties as well if we can better prepare patients in self management, for instance, management of heart failure signs and symptoms, we can reduce the
Hmm.
number of readmissions in 30 days. And that makes a difference to the hospital's bottom line as well.
So that's going to go back to data tracking. Hmm. Lots of
Yes,
data tracking.
a lot
One
of
of the
data
things,
tracking.
one of the things that I have noticed that is hard to show or to quantify, I guess is the right word, to quantify the benefit of having a nurse educator in the hospital, because it's not necessarily linked that closely to revenue. It's linked to cost. How much are you costing me? And so do you see this as well for the nurse scientist role, that sometimes it's hard to quantify the need and how we benefit an organization, and how do you suggest quantifying this?
Yeah, so I think that's a really excellent question, excellent point. It's something that I even experienced when I was a
Hmm.
clinical nurse specialist for
Hmm.
20 years. And I think this is going to become even more important in today's healthcare environment and the political arena that we're in, is we need to be able to demonstrate the value that we bring and
Right.
to create a dashboard and to keep track of, the work that we're doing that ties to these different organizational priorities, to be tracking that data and to be able to quantify that in a cost containment fashion. And other ways too, in terms of nurse engagement, there's evidence to show that involving staff nurses and an evidence based practice improves their job satisfaction. So you can see that on nurse engagement and even on retention levels. So we need to really be thinking about the different ways that we can show our impact. And then another metric has to do with being on the magnet journey. Nurse scientists have a massive role to play in building a hospital infrastructure for research and evidence-based practice, and then
Hmm.
mentoring staff in those sources of evidence and coming up with the stories to be able to obtain magnet designation.
Absolutely. Yes. It's all about, lately, it seems it's all about quantifying costs. And sometimes when you have roles like this, we see the importance of that role, but your leadership doesn't see the importance of it. They just see the cost. the
Mhm.
cost of it. So,
And there are new models out there that are looking at the human capital of nursing and that we are not just a cost,
mhm.
department, that we are, and a valuable player that can help to drive revenue and value in an organization. So I'm really looking forward to seeing how that nationally can help change, the environment that we all work in.
Yes, that's really good to keep an eye out for as well. Do you know when that is going to be released?
There's it's already in the literature. I don't have the citation
Okay.
and the author's name off the top of my head, but you can, look for, um, human capital and nursing.
Okay. Yeah. So that's something
Yeah.
good that we can look at as well. And maybe that's something that can be brought to leadership too
Mhm.
if and when you get called into those types of conversations, because if you're in a role like that, a lot of times you are going to be called into those and need to speak to what you bring to the table versus
Mhm.
what you cost them as in their eyes. And then really that leads us to collaboration, because as nurses, regardless of what role that we're in, we have to be able to collaborate. And you also identified that as a key skill. So what role does collaboration play within the nurse scientist role, and how do you engage with interdisciplinary teams?
Mhm. So collaboration is really the heart of what nurse scientists do. We don't, practice in a vacuum. We need to be
Yeah.
collaborating with the frontline nurses, with different members of the interdisciplinary team, depending on, what the specific health related inquiry topic might be. So we can collaborate with physicians, pharmacists, folks in the laboratory department, public health, and even engineering. We serve as principal investigators and co investigators on those research teams and EBP initiatives. So I think it's also important for nurse scientists to consider partnering with patients and families and bringing them into their research teams so we can be answering research questions and measuring patient specific outcomes that matter the most to patients. And that really
Mhm.
has been a strong movement of PCORI over the last 15 years, is to bring patients into the fold. So we are developing research that matters really to those that we serve. So a lot of different individuals that we collaborate with, and it only makes the quality of the research stronger because we're bringing together these diverse ideas, perspectives, funding opportunities, ways of looking at outcomes and health equity. So there's lots of
Mhm.
benefits to collaborating across the spectrum. As well as being able to scale up and to have multi site studies that will generate stronger high quality evidence to the questions that we need answers to.
Right. And while you were talking about the collaboration within different teams, one of the things that I was thinking about is if you look online, especially on like social media, websites where they have job descriptions, a lot of times you're going to see job descriptions, and usually they're looking for a nurse who is going to assist in um, being a part of different clinical studies that are happening, maybe pharmaceutical studies that are happening, and basically working with the actual patients and answering questions. And but what you're describing to me doesn't necessarily sound like the role of a nurse scientist. Is there a connection there?
I think what you're describing is a clinical research coordinator that's helping to administer a clinical trial and is
Mm,
recruiting patients into a study.
mhm,
So, a nurse scientist certainly could be interacting with those individuals, but typically that role is focused on industry led research that a
mhm,
hospital or a physician group might be a site
mhm,
for,
mhm, mhm.
so that or different oncology cooperative groups.
Right.
Um, so it is a little bit different.
Yeah, and I wanted you to be able to differentiate for the listeners that this is not necessarily the same thing that you see, because you do see quite a few of those types of job descriptions, especially now. And a lot of times they are remote. So you're going to see them underneath the remote heading. And I didn't think that that particular type of role was the same type of role that we're talking about today.
Yeah, you're exactly right. It is not.
Okay. Now, how do nurse scientists contribute to the evidence-based practice and patient care improvements? What are those things that we're able to bring to the table when we're allowed at the table, when we're allowed
Mhm.
to sit at the table?
Mhm. Well, first, I'd just like to back up and say that the nurse scientist has a really pivotal role in our organization to help create the culture that's needed for evidence based practice to flourish. So, we know that there needs to be a strong philosophy and commitment to evidence based practice. We need leadership support, leaders who understand evidence based practice.
Hmm.
They walk the talk, they provide the resources that nurses and the interprofessional team need. They support mentorship for nurses and education. So that's really kind of a fundamental role of the nurse scientist is to ready the culture and to help to shore up the infrastructure. And then we also often will lead or participate in EBP education. So we're developing the capabilities of nurses and interprofessional team members. So many hospitals and healthcare systems have nurse residency programs
Hmm.
for new graduate nurses and
Hmm.
nurse practitioners, as well as academic practice partnerships, such as the VANAP program when I was at the Portland VA. I would present and talk with VANAP students. So that stands for the VA Nursing Academic Partnership with OHSU, Oregon Health Sciences University, to help those VANAP students learn about research and evidence based practice. And
Hmm.
other educational opportunities are EBP fellowships that are typically 9 to 12 months long, where the nurses apply and they're accepted as a fellow and they're matched with a mentor and apply that learning to their real world practice problem that they want to solve as an evidence based practice fellow. So I think those are some of the really critical elements of a nurse scientist to help build the culture of EBP and to educate and to mentor nurses and students, helping them refine their practice problem, helping them refine the question, reviewing their evidence table, helping
Hmm.
them know that they need an evidence
Hmm.
table,
Hmm.
reviewing the results of their tests of change, and then putting it all together into a package for dissemination. So
Right.
there's lots of ways that nurse scientists are important to help lead efforts, but also to build the capabilities of others. So there are
Hmm.
many EBP practitioners that the skill set doesn't reside in just a few
Hmm.
individuals, but
Hmm.
it's being built across the workforce.
Absolutely. I want to go back to a seat at the table, because when you're saying, okay, this is all about the culture. So it's how quickly we can prepare the culture to to accept implementation, how quickly we can prepare our nurses, our new nurses, mentor and precept them in order to have a mindset towards EBP and integration. And without a seat at the table, without bringing in nurse scientists to have a seat at the table, then it's going to take longer for organizations to be able to put in place the latest evidence-based guidelines and practices versus, staying the old way. What was that? What was the name of your research? The not
Implementation?
de-implementation, which can also help save money if we can de-implement some things and implement the correct things. So without a seat at the table, the organizations, it doesn't seem like it's the advancement within their organizations is going to happen as quickly.
Yeah, I think that by creating the culture and building the skill set, nurses create the table and
Yeah.
we bring the people to the table.
Hmm.
We are leading those efforts and we're collaborating with others, but we don't wait to be asked. We're asking the questions, we're seeing the need, what patients want, and
Hmm.
we're convening the table. That's what I like to think of. But be
Yes.
able but to be able to do that, we need the culture, we need the resources, we need the leaders that support the staff to
Hmm.
build their capabilities. So when we're at the table, we have the skills to move forward.
And we need the leaders to allow us to convene the table.
Yes,
And
absolutely.
I see that as a big challenge for nurse scientists and facing, being able to conduct research and integrate research. Are there other challenges that you can think of that, and how do we overcome them within organizations?
There are actually, quite a few challenges to this role, but there's challenges in any role, regardless
Hmm.
of what discipline that you're in. So I'm going to highlight a few. The first one is that there is really no standard role or set of competencies for a nurse scientist.
Hmm.
And I've been learning more about this. I recently attended Sigma Theta Tau's research congress, and there are nurse scientists across the country that are really working hard to standardize what the role of the clinically based nurse scientist is. Because when there's
Hmm.
a wide variation in qualifications, functions, and how
Hmm. Hmm.
the impact of this role is measured, we're not optimizing the role for its greatest level of impact. So, some of the solutions really are to participate in some of this cutting edge research that is coming out to vet what the core competencies are
Hmm.
of nurse scientists. And once these set of competencies come out, to really advocate for role standardization at institutions so nurse scientists can practice to the top of their license and the top of their education. So
Hmm.
I think that's one really large challenge. Another is balancing our clinical practice and research, or whatever dual role we might have. So we may have to
Hmm.
juggle clinical, teaching, or administrative tasks. So that can really strain our time and our focus. Some solutions are to negotiate dedicated portions of our time for research and clinical time, or those other roles, so we don't lose sight of the research part
Hmm.
of our role. One of the things that I've used a lot is blocking my calendar and using the time of day that I'm the most productive to do the work that I need to focus the most on to have the greatest impact. So I think we
Yeah.
have to take control of our time and know when we are at our best. And I think other ways to balance our loads are to engage in collaborative research with others so we can really spread the wealth. We don't have to do it all, but we
Hmm.
can build on the strengths of all of the different members of the team. Let's see. Another challenge that nurse scientists face is funding and resource limitations. You know, obtaining a grant is a highly competitive process, and
Yes,
now
it
with
is.
potential changes in some of the federal dollars that may be available for nurse scientists, is only going to get more competitive for some of the
Hmm.
foundation and professional organization grants that nurses can apply for. So, some solutions there is really to build your writing and your grant writing skills, attend grant writing workshops, partner with experienced mentors, and always leave enough time for critical feedback and to take that feedback to heart. Don't take it as a criticism, but really take it as a way to make your argument stronger of why your research needs to be funded.
Right. And it's always hard to not take that feedback. Um, Now, looking at the future, emerging trends, the direction that nursing research is headed, where are we headed? How are nurse scientists leading the way in some of these areas?
One really important trend that's been with us for a while, and the need continues, is health equity and social determinants of health. So,
Hmm.
nurse scientists are examining how housing, education, income, and access to healthy food influence health outcomes. And so, by understanding the relationships between these different elements, nurse scientists can help develop and test interventions that target individual social and structural factors that create health. AI and technology integration is another wave of the future. I remember when I first started hearing about AI, I think it was in March of 2023. It seemed like it popped out of nowhere, and it is just going,
Blown up. Yes.
it's just blown up.
Yes.
Yeah, so nurse scientists are harnessing artificial intelligence, marine machine learning, natural language processing, wearable sensors, as I
Hmm.
mentioned with Roxana Chicas, research and virtual reality to improve patient care, diagnostics, personalized treatment plans, improve predictive analytics, and streamline workflows. Another emerging trend that started during the pandemic focuses on nurse well being and retention. The pandemic really heightened our focus on mental health of nurses and clinicians, their resilience, and how do we retain our important workforce. So, some of the research priorities are addressing unsafe staffing, heavy
Hmm.
workloads, workplace violence, designing interventions like nurse residency programs, mentorship, and peer coaching, and really taking a hard look at our work environments and building healthy work environments to drive engagement and to reduce turnover.
Yes, and that is so important. The turnover is huge right now. The culture is struggling within healthcare. Yes, those are all such. AI is, where we're going to see it, where all AI is going to fall is going to be interesting to see as well because there's so many different avenues. I do not think that it is putting nursing as the role in danger at all of going away because so much of what we do needs heart as a nurse, and there's just no way that we can not have nurses. So that does not concern me, but I am interested to see where all we're going to see AI within our
Yeah,
roles.
yeah,
Mhm.
absolutely. I think it's going to help us streamline our workflows. I think there's a lot of
Yes,
great possibilities that can help us work more effectively and more efficiently, but not replace us.
absolutely. And help take some things off our plate, help make some things easier to do that are on our plate so that we can get back to the heart of what we do, and that's the patients. That's what I am hoping for with AI and the technology that's coming from AI. That personally, that's what I'm hoping for. But how can healthcare organizations really support and foster the development of nurse scientists or even having a nurse scientist role within their organizations?
Yeah, so I think first off, learning about the nurse scientist role and the value that they bring and
Hmm.
understanding how it can move your strategic priorities and outcomes forward. So, first, most learning about it and then aligning with those national standards that are emerging, engaging with national initiatives to define and standardize the role and using
Hmm.
them in job descriptions, performance measures, and professional development plans. I think another way that healthcare organizations can support the nurse scientists is to ensure when they are onboarded that senior leadership and the chief nurse executive supports the role. So having executive support of the role is really a key facilitator of the role. If you don't have that, the full impact of the role just is not going to be realized. So we talked earlier about maybe a quarterly dashboard or report
Hmm.
where nurse
Hmm.
scientists can be sharing what are some of the ways that they are bringing value. How are they impacting quality? How are they impacting patient experience or safety? How are they driving nurse engagement by
Right.
working with frontline nurses on ABP and research? How are they impacting magnet or pathways to excellence designation? And how are they contributing to the body of knowledge? So I think that that's another way is to really make sure that the executive support is there for the role and providing protected time and resources to the role. We need to have dedicated, protected time for our research. We need to have access to all of the tools, statistical software, data storage, research databases. We need to be able to attend conferences to stay abreast of changing science and different methodologies. And we also need access to consultants like statisticians and methodologists. And then lastly, I would say to ensure that we are providing mentorship and career development for nurse scientists. Depending on where nurse scientists practice, they may be the sole nurse scientists, as I have been in at least two organizations, and so that can create some professional isolation, and we need to find ways that nurse scientists can be mentored and be in connection with others in the
Uh-huh.
field
Hmm.
to help with our professional development and growth.
Right. And you're talking about advocating. So let's take that a step further. And how can scientists actually advocate for the importance of nursing research within in the broader healthcare community?
So, first, I would say we need to raise awareness and build public support about the role of the nurse scientist. We talked earlier in the podcast that many people may not know
Hmm.
what a nurse scientist is or that there even was such a role. And I think that somewhat goes back to many people in the public don't fully understand what a nurse does,
Hmm.
in our
Hmm.
basic role as a frontline clinician.
Right.
So we really need to build awareness around the impact that we have. The American Academy of Nursing has a campaign right now called the SAVE campaign, and it stands for Science Adds Value for Everyone. And
Mm.
this is a campaign that's amplifying the real world impact of nursing science through testimonials, stories, and evidence. So I think
Mm.
tapping into that campaign and educating the public on how nursing research promotes health, prevents disease, and improves care is a great place to start.
Right.
Another way that we can advocate is to have a seat at the table to collaborate with
Hmm.
disciplines across the board in our healthcare institutions to ensure that the nursing perspective informs the research questions and the analysis. And then we can also act as a bridge between the research and clinical practice, working with our colleagues to translate those findings so the real world impact of those research questions can be um, experienced by patients and families and those that we serve. We need to disseminate our research broadly, not just in nursing journals, but also in interdisciplinary journals and present at
Hmm.
conferences for both healthcare professionals and the public. And I think that we don't do enough of that, sharing our
I agree.
findings with the public. So we can use things like podcasts, social
Hmm.
media, online platforms to be able to share the results of our findings. And PCORI does a really nice job of that by sharing lay synopses of research that patients and families can understand. So that's an
Right.
example of how we can be sharing the impact of what we do and how it brings value to health.
Mhm. And don't be afraid to pull up a seat. When even in within your community, being able to be a part of discussions of policy and policy need changes and implementation of policies. Don't be afraid to go to the table because we do bring a unique perspective of community health to the table. We have the knowledge, even if we're not a nurse scientist, you have the knowledge to act in that role, and I think it's important to point that out.
I think it's a really important point that it's not just the role of the nurse scientist. Nurses
Mhm,
everywhere have a role in
mhm,
educating the public the value that we bring through our
mhm.
care as well as through the science that we're a part of.
Absolutely. Now, as we get ready to wrap this up, I wanna ask if there's anybody interested in becoming, or pursuing a career as a nurse scientist or becoming a nurse scientist, what advice do you have for them?
This is a really fun question. The first thing I would say is to get curious. Most of the roles that I've taken in nursing have been because I saw nurses in unique roles and I allowed myself to get curious. So I wondered, what in the world is that role that they just accepted?
Mhm,
How does it fit into my role as a clinical nurse? And how does it make a difference? So, as a younger clinical nurse, I knew I wanted to obtain a master's degree. And the
mhm,
program that I applied to, they had a nurse educator track. So I initially thought I'll become a nurse educator. But as one of my colleagues stepped into the clinical nurse specialist role and I started watching her in action, I wanted to learn more about her role. So I sat down and talked with her about her role and I asked to shadow her. And that experience really helped me kind of change my mind when I entered my master's program and switched to the CNS track because it really
mhm.
blended. And I knew that I liked asking questions and clinical practice. So I saw the CNS role as a bridge between clinical practice and research. Then when I became a CNS and I was very established about 20 some years ago, I saw more and more CNSs going back to school to get a PhD to become a nurse scientist. And I saw these nurse scientists in the clinical setting conducting research, involving staff. And that's when I knew that's what I wanted to become, is I wanted to be a nurse scientist. I wanted that opportunity to bridge clinical practice and research to make a difference. So first I would say get curious. Then I would say learn from other people in those roles, and then follow your passion. I think that's the key, is really think about what brings you the most joy at work, and to help you develop your niche, explore the different pathways that are needed to get the education and the skills that you need. And then I can't underscore the importance enough about finding a mentor or a group of mentors that will invest in you, that have a strong research background and track record, that are willing to share their experiences, what has worked for them, what didn't work, and are really willing to invest in you and your career. So get curious, have fun exploring all the different roles that the nursing profession provides. So it's really an exciting and an impactful role.
Absolutely. I think you should add curiosity or being curious to those key skills that you need to have. Because when I think about scientists and I think about research, I think about curiosity, asking those questions and not just being okay with this is how we do it, but being curious about why do we do it that way? Why
Absolutely.
do we do it that way? Could we do it this way? So curiosity, I think, is very
Mhm.
important for this role.
Yes.
Well,
And then what does the evidence say we should do?
right. Yes. Well, thank you so much, Dr. Margot Helm, for joining me today for this podcast. And just, it was a struggle for me with my cold. So thank you, as I was struggling to find some of my words. So thank you for your patience. And, in this discussion, it was so great. I love learning from you today. And I can see your passion for what you do, for the research that you're a part of, and just your joy for your partners and your coworkers as they've also made these discoveries. Just watching you light up talking about their successes, wow, what a great friendship. What a great friend.
Well, thank you so much for inviting me today. It's been really fun talking about this role.
Yes, absolutely. To our listeners, whether you're a nurse considering a career in research or a healthcare leader looking to foster a culture of innovation, the role of nurse scientist is one we should all be championing. We need to recognize and support their contributions and integrate their findings into clinical practice when it's appropriate. Nurse scientists, they're a necessary bridge between clinical practice and research, driving that innovation that helps improve patient outcomes. From advancing evidence-based practice, as you've heard here, to addressing health disparities, their work is essential to the future of healthcare. So if this is something that you're interested in, we recommend that you check it out. Thank you for joining Margot and I for this discussion, and I encourage you to explore many of the courses we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.